Hi guys. Yeah, so start posting your doubts. Uh, Start posting your doubts and we'll start answering. As promised, today I'll be taking the academic doubts, and please, it's a request. Please be specific about your doubts. Hi Prashant, Ravi, Shiv, Aarti. Please be specific about your doubts and keep start posting your doubts so that I can answer your so we can take both academic doubts as well as the strategy related doubts. Please tell orbital cellulitis. So basically, what you want to know about orbital cellulitis is the extension of the preseptal cellulitis. If the infection is there only anterior to the septum, then it is the preseptal cellulitis. When it is going posterior to it, then we will end up in orbital cellulitis. And usually we have got high risk factors like acute ethmoidal sinusitis, or when the dangerous areas of the face are involved. नहीं, मैं हंसती ही रहती हूँ. हंसने इज नॉट अ um, so it these are the high risk factors like acute ethmoidal sinusitis. We can have the infections in the dangerous area of the face that can lead to orbital cellulitis. The most common infective agent is the Staph aureus, and even this orbital cellulitis itself can lead to another emergency that is called as the cavernous sinus thrombosis. Plus, one more important thing about orbital cellulitis is that the name of the classification that we follow here is the Chandler's classification. And second thing is that it is the most common cause of unilateral proptosis. It is the most common cause of the unilateral proptosis. In cases of children, that is your orbital cellulitis, right? So basically, we are not worried about orbital cellulitis. We are worried about the cavernous sinus thrombosis, and orbital cellulitis is one of the risk factor of cavernous sinus thrombosis. That is why the cellulitis is important. So all these things are important. I have told you. Uh, Doraemon and Nobita. Thank you so much. Your lectures are awesome. You're a genius, honestly. Thank you so much, guys. Um, okay, so what is the next? Ma'am, retina. Manoj, I told you be specific. I cannot take whole of the retina. So anything specific that you want me to take, please ask about that. Please don't say retina. हाँ, मैं सबका मैसेज देख के हँस रही हूँ, जिस मैसेज को देख के हँसने वाली बात है, वो देख के हँस रही हूँ. प्लीज़ आस्क द एकेडमिक डाउट्स. कल पूछ रहे थे तुम लोग, एंड कल आई एक्चुअली यस्टरडे आई वांटेड टू जस्ट हैव अ hello, hi, and to know what is your status going on. And from today, I'll be taking the academic doubts. So, what are the other things that you wanted to ask? Have you started studying? You can share your experiences, any difficulties that you are having in your plans and strategies. कंजंक्टाइवल साइंस ऑफ द ट्रेकोमा. हाँ, तो ये स्पेसिफिक था. कंजंक्टाइवल साइंस ऑफ द ट्रेकोमा में वेरी वेरी इंपॉर्टेंट दैट वी गेट अ mixed response in cases of conjunctiva. We get both the follicles as well as the papillary hyperplasia. The type of follicles that we get here are the sago grain follicles, and the other thing that we get is the papillary hyperplasia. The type of follicles are called as sago grain follicles because on gross appearance, they look like the boiled sago grains. And the other thing that we get is the papillary hyperplasia. It is a hyperplasia of the blood vessels there, that is called as the papillary hyperplasia. And here we have a mixed response. Now, due to this, we also have the scarring in the sulcus subtarsalis. Scarring in the sulcus subtarsalis is there. Just a moment, guys. Yeah, so I was saying that we also have the scarring in the sulcus subtarsalis, that is called as the arch line. Then finally, we will have concretions. They are the collections of the dead cells and the debris. So if this is the upper eyelid, we will have the concretions there. And when this person will close the lid, what will happen? They will rub the cornea, and that is why we can have the corneal erosion and corneal ulcers. So all these five are very very important signs in the conjunctiva. Today you look like Miss Word of Ofthel. आपके पासन सीरीज देखी है तो हम आपको ही देखते रह गए थे आपकी आंख ओके योर स्माइल इज ऑसम एंड यू लुक गॉर्जियस oh thank you so much guys so सिम्ब्लिफ्रॉन है बहुत सारी चीजें आ रही हैं वो एकदम से स्क्रॉल अप हो रही है सिम्ब्लिफ्रॉन मींस व्हेन वी हैव अडेशन ऑफ द टू कंजंक्टिवा एक होता है एंकाइलोब्लिफ्रॉन वन इज द सिम्ब्लिफ्रॉन एंकाइलोब्लिफ्रॉन मतलब व्हेन वी हैव द अडेशन ऑफ द टू आईलिड्स and symblepharon means when we have the adhesion of two conjunctiva symblepharon is formed due to a very important thing, that is your true membranous conjunctivitis. So that is an important MCQ. When we have pseudo membranous conjunctivitis, that can not lead to symblepharon, but when we have true membranous conjunctivitis, it will lead to the raw area and that can lead to symblepharon. ठीक है? कॉन्टैक्ट लेंस टॉपिक में एमसीक्यू कैसे प्रिपेयर करें मैम विच बुक व्हाई डू यू वांट टू हैव स्पेसिफिकली कॉन्टैक्ट लेंसेज थोड़ा सा बताओ साइंस इन एंटीरियर यूवेइटिस सो आइरिडोसाइक्लाइटिस है वी हैव इन्फ्लेमेशन एंड श्योर तो जस्ट अ सेकंड इतने सारे क्वेश्चंस एक साथ आ गए तो साइंस की अगर बात करते हैं साइंस इन द एंटीरियर यूवेइटिस जो अर्लीस्ट साइन होता है दैट इज योर एक्वस फ्लेयर ठीक है एक्वस फ्लेयर मींस टर्बिडिटी then we have aqueous cells means we have inflammatory cells these inflammatory cells are the exudates when they become very heavy they will settle at the bottom and they will form the hypopion. So we have the aqueous cells, we have aqueous flare, we have hypopion, circumcorneal congestion, redness will be there. And then we have got so many signs in the iris. Iris nodules, question आता है, कोई nodules and Busaka nodules, posterior synecdoche भी होगा, type of pupil small, meiotic, constricted, irregular, fixed, all these things are very very important. ठीक है वो मिलेगा और उसके बाद टाइप्स ऑफ स्ट्रैबिस्मिक एम्ब्लायोपिया तो ये बहुत ही स्पेसिफिक है ये वाले टॉपिक्स क्या है कि इसमें समझाने वाला नहीं है इट्स अ थ्योरेटिकल टॉपिक और वो भी स्ट्रैबिस्मिक एम्ब्लायोपिया टू बी वेरी स्पेसिफिक तो दीज आर द टॉपिक्स दैट आई विल कीप ऑन नोटिंग एंड आई विल गिव यू अ शॉर्ट वीडियो ऑन दैट ठीक है ना आई विल गिव अ शॉर्ट वीडियो ऑन एम्ब्लायोपिया और संगीता is asking about corneal ulcer so beta you have to tell me if you are looking for any specific ulcer because corneal ulcer is a long topic and I have already given the video over the corneal ulcers where I have compared the bacterial ulcers fungal ulcers viral ulcers and then acanthamoeba ulcers so let me know if it is okay for you ठीक है ओ माय गॉड वर्नल केरेटोकंजंक्टिवाइटिस वर्नल केरेटोकंजंक्टिवाइटिस बहुत सिंपल सा है इट इज द मोस्ट कॉमन एलर्जी कंजंक्टिवाइटिस मेल्स में इट इज कॉमन उसके अलावा 5 to 15 years ऑफ एज है and it's a type 1 hypersensitivity reaction where the patient will come in hot and humid climate with intense itching so if he is coming with intense itching hot and humid climate, and 5 to 15 years of age with the type 1 hypersensitivity reaction, and it's a exogenous allergy, then we are thinking about this vernal keratoconjunctivitis. Then three things are very very important, जिसमें से एक है द रोपी डिस्चार्ज, द स्टिंगी डिस्चार्ज, ठीक है. उसके अलावा वी हैव गॉट द कॉबल स्टोन पैपिली. तो अगर स्टिंगी डिस्चार्ज है, cobblestone papilli, Horner Trenta spots, type 1 hypersensitivity reaction, exogenous allergy, ये सारा है तो इट्स अ वर्नल केरेटोकंजंक्टिवाइटिस. ठीक है. ठीक है मैम, ये संगीता मेरी क्लासमेट है, वो कुछ भी क्वेश्चन पूछती रहती. ओह माय गॉड. व्हाट व्हाट इज द डिफरेंस बिटवीन वायरस इन्फेक्शन एंड बैक्टीरियल इन्फेक्शन? कहाँ? और आई एम फ्रॉम नेपाल, आई एम प्रिपेयरिंग फॉर बायोमेट्री लाइसेंस एग्जाम, सो कॉन्टेक्ट लेंस टॉपिक में एमसीक्यू कैसे तैयार करें? ओके ओके. तो एक तो बायोमेट्री एमसीक्यूज का जो बुक है वो सेपरेटली अवेलेबल होगा. आप फ्लिपकार्ट अमेजोन पे चेक कर सकते हो, बुक स्टोर पे चेक कर सकते हो, और नहीं तो आप ऑनलाइन भी जाओगे तो यू विल गेट द एमसीक्यूज ऑन कॉन्टेक्ट लेंसेज पीडीएफ फॉर्म में वो है, देन यू कैन डाउनलोड इट ऑल्सो. ठीक है, वो आप कर सकते हो. Why accommodation reflex remains intact in optic nerve lesions while the light reflex is lost? अच्छा, तो इसमें क्या है कि see, accommodation is occurring due to both the eyes, while light you are showing only in one eye. So when we are accommodating, we can get a light accommodation reflex due to the other eye, because accommodate you cannot do with one eye. That is the reason that you can get light or the weaker kind of accommodation reflex. I want to get a good rank in NEET PG so that I could interview with you. Oh, that is, one more feather in the cap. But anyhow, you should get a good rank, and I am sure that you will be interviewed by any great personality. And I think you will work hard. You have to work hard, really, really work hard for doing so. And if you have any difficulty, then we are there to help you, right? Uh, देन और क्या है ये? पीएमडी एंड टीएमडी. आई कुड नॉट गेट दिस पीएमडी एंड टीएमडी. थोड़ा सा मुझे बताओगे व्हाट यू आर आस्किंग अबाउट? ई न्यूक्लिएशन एंड इविसरेशन ये सिंपल है. ई न्यूक्लिएशन मतलब व्हेन यू आर रिमूविंग होल ऑफ द आईबॉल, ठीक है, अलोंग विद द पार्ट ऑफ ऑप्टिक नर्व. Evisceration, where you are cutting a small button in the sclera, then you are scooping out the contents of the eyeball, and then we are putting a artificial eyeball, and then we are suturing the sclera back. That is called as the evisceration. So basically, whenever we have the intraocular tumors or something, then we are doing the enucleation. And when we have got the bleeding anterior staphylomas, expulsive choroidal hemorrhage, all these things, then in those cases we are doing the evisceration, right? uh एक minute, just a second. Okay. uh I do know. I think that is some reflection going on. mm, then any other question? I have confusion in conjunctivitis and its types and subtypes. Okay. ऑफ्थल रैपिड रिवीजन का सेशन का रैपिड रिवीजन का एक सेशन लो. हाँ हाँ, वो तो होगा ही होगा विवेक. रैपिड रिवीजन ऑफ ऑफ्थैल का एक नहीं, बहुत सारे सेशंस होंगे, बोथ फॉर द नीट एज वेल एज द एफएमजी स्टूडेंट्स. डोंट वरी अबाउट दैट. प्रॉफ एग्जाम्स के लिए तो एक तो अगर यू आर रीडिंग फ्रॉम माई नोट्स डोरेमोन नोबिता आई डू नॉट नो, तो 90% ऑफ द जो क्वेश्चंस हैं इवन फ्रॉम द प्रॉफ एग्जाम्स, दे आर कवर्ड फ्रॉम योर नोट्स ओनली. तो यू हैव टू डू द थॉरो रिविजन. उसके अलावा फॉर योर वाइवा एंड द प्रैक्टिकल्स, डू वन थिंग, गो थ्रू द माई इंस्ट्रूमेंट वीडियो. अच्छे से इंस्ट्रूमेंट वीडियो देखो, And the PDF of that instrument video is also available in the file section of my group, so you can download that PDF and look at the instruments. So instruments भी हो जाएगा, and all the major topics, because long question आता है cataract पे, glaucoma पे, corneal ulcers पे, या फिर visual pathway defects. So all those long questions are easily done with the help of that, तो कोई प्रॉब्लम नहीं होगी. प्लीज डिजीज वाली सीरीज बनाओ. डिजीज वाली सीरीज मतलब ऑफ्थेल रैपिड रिवीजन का सेशन मैंने बता ही दिया. आई विल टेक ऑफ्थेल, यू आर माय इंस्पिरेशन. ओह गुड, वेलकम टू द फ्रेटर्निटी. इफ यू वांट टू टेक द ऑफ्थेल, you are most welcome. And but don't take ophthalm due to me. Take ophthalm if you have some passion. Acha, ha, I missed your this one. How to determine the 7 points in the visual test interpretation. So I have made one video on this also. If you see na the videos on my YouTube, तो उसमें मैंने HFA का एक सेशन लिया हुआ है, द Humphreys फील्ड एनालाइजर ऑटोमेट्री. तो उसमें आई हैव टोल्ड अबाउट ऑल द पॉइंट्स. तो अगेन उसके लिए आई रिक्वायर द पेन एंड पेपर, एंड तो उसमें मैंने सब कुछ एक्सप्लेन करा हुआ है. तो आई वुड रिक्वेस्ट यू टू गो थ्रू दैट वीडियो वंस, एंड वी कैन गेट बैक if you do not understand anything there. You are my YouTube follower. Okay, welcome. So, guys, all of you who are watching the video, please like the video, please subscribe the channel, and please share the videos, whichever videos you feel like that they can help, they can be of some help to your friends also. Viral keratoconjunctivitis. See every day like you look like a angel while teaching. Okay. बहुत देर से आपने ऑफ्थेल का बताया, अभी तो हंसो मैम. ओके, तो वायरल केरेटोकंजंक्टिवाइटिस नहीं है शायद मनोज. इट्स अ वर्नल केरेटोकंजंक्टिवाइटिस. शायद तुम उसके बारे में पूछ रहे हो. प्लीज लेट मी नो इफ आई एम राइट. थैंक यू सो मच अबाउट द लवली कमेंट्स एंड अप्रिसिएशन. थैंक यू. मनोज एक बार बताना. आई थिंक यू आर टॉकिंग अबाउट वर्नल. Hi, 1 lakh. Yeah, it's not after a year. I think I was there on my channel and the DPMCI channel also. I keep on coming live. अभी थोड़ा सा लॉन्ग गैप हो गया, बट इट्स नॉट अ ईयर. आई थिंक ईयर वाला गैप तो नहीं हुआ है अभी. तो I think what you can do, because from now on I'll keep coming live very frequently and consistently. Please keep on writing your doubts in a notebook, so that whenever I come live, you can open that notebook and you can start asking. Because I want that out of 19 subjects, you are left with only 18 subjects. Of hell becomes a piece of cakewalk for you. And every day we can do a little bit of revision, a little bit of tel, so that at the end you are not there with a lot of things which are not filictinular vernal. Yeah, so there is a clear cut contrast between the vernal keratoconjunctivitis and filictinular keratoconjunctivitis. Vernal is the most common one, that is more common in boys, while filictinular, this is, yeah. So listen to this, Manoj. I'm telling you the same topic. Vernal hai, and ठीक है. वन ऑन वन साइड वी हैव वर्नल एंड ऑन वन साइड वी हैव फिलिक्टिन्यूलर. तो वर्नल जो है वो टाइप 1 है. दिस इज टाइप 4. दिस इज मोर कॉमन इन मेल्स. दिस इज मोर कॉमन इन फीमेल्स. दिस इज डिफ्यूज. दिस इज नोड्यूलर. दिस इज एक्सोजीनस एलर्जी. दिस इज एंडोजीनस एलर्जी. And that is why the treatment of choice is also very different. When we have got the type 1, then it is the olopatidine antihistaminic plus the mast cell stabilizer. While when we have filictinular nodular keratoconjunctivitis, the type 4 endogenous steroids are the treatment of choice. Right? Uh, Oculocardiac reflex. I think you are asking about the oculocephalic reflex, which has come latest, or you are asking about the oculocardiac reflex only. Oculocardiac reflex, so basically, is this stimulated due to the squint surgery, the from the extraocular muscles, and one is the oculocephalic reflex that has recently been asked in the INI-CET November 2022, जिसमें when we are doing the head tilt, the eyes are going in the opposite direction. So I do not know which reflex you are asking. You can specify it. उसके अलावा थोड़ा सा ये भी देखो. You have a beauty. या सो अब एक चीज ये भी देखना कि देर इज अ वे हाउ टू रीड अ पर्टिकुलर टॉपिक. तो अगर हम ऑफ्थेल से स्टार्ट करते हैं, वेन एवर यू आर रीडिंग द टॉपिक, प्लीज सी द इमेजेस ऑल्सो. उसकी इमेजेस जरूर देखना, बिकॉज विजुअल मेमोरी ऑलवेज लास्ट लॉन्गर. तो अगर आप उसको टॉपिक को पढ़ते हो एंड देन यू कीप ऑन लुकिंग एट द इमेजेस ऑल्सो, देन इट्स अ वेरी वेरी गुड वे of revising. And if you will say, then I can keep some of the quizzes in the image based form also, jisme ki only image and only little of theory will be there, so that you are able to recognize it. Yeah, so yes, oculocephalic reflex jo hota hai, that is your doll's eye movement. Yeah. B scan means, B means brightness scan. This is the two-dimensional ultrasound. It's a two-dimensional ultrasound basically that we are doing in the eye, and one-dimensional ultrasound is the A scan. ठीक है ना? Visual evoked response. So like we have got EOG, like we have ERG. These are the electrophysiological tests. The third is the VER, called as a visual evoked response. Okay, so it is just similar to the EEG of the occipital lobe. We are putting the electrodes at the occipital lobe, and then we are taking the uh, amplitudes, right? So what happens in cases of, like, if I measure it in the optic neuritis, most common cause जो है, that is your multiple sclerosis, which is a demyelinating disorder. So there you will get the prolonged latent period and decreased amplitude. So this is how we can interpret the visual evoked response. ठीक है? नेक्स्ट क्लास कब होगी? कौन सी वाली क्लास? दिस क्लास यू आर टॉकिंग? विच नेक्स्ट क्लास? जय माता दी, जय माता दी. Any other questions? और one thing more, what we can do is कि डेली जो हम क्या कर सकते हैं, वी कैन फिक्स वन टॉपिक, जिसमें क्या होता है कि ऑल ऑफ यू कैन कम अप with the questions from the same topic, so that we can have more elaborate discussion. अभी क्या है कि एक कंजंक्टिवाइटिस से आ रहा है, एक अल्सर का आ रहा है, एक लेंस का, एक ग्लोकोमा का. तो हम ये भी कर सकते हैं that what I can do is that we can fix one topic in the morning, read that topic, and then in the evening we can have a discussion over it. जैसे कि tomorrow I can keep lens, then we can keep glaucoma, squint one day, neuro ophtha one day. तो उससे क्या होगा कि everybody will be asking the questions from the same topic. तो मेरे लिए भी easy होगा, and for you also it will be easy to get the revision. Lens. Can we do lens tomorrow? Give me a thumbs up if everybody is convinced with the lens tomorrow. Can we revise the lens tomorrow? Cataract surgeries, type of cataract, complications. Please give me a thumbs up. Let me see. न्यूरोफ्थेल भी करेंगे ना, लेकिन पहले से इजी से स्टार्ट करते हैं, देन वी कैन गो विद दिस. टाइमिंग आई थिंक tomorrow we can keep at the same time. 8 p.m. is okay? No, क्यों? Tomorrow 8 p.m. can we keep the lens? Conjunctivitis we can keep on the other day, na? Tomorrow we can keep lens, then other day we can keep conjunctivitis, another day we can keep keratitis, other day we can keep glaucoma. अभी तो बहुत सारे दिन है, and then we will have multiple revision. दोबारा भी आ सकता है. What about lens tomorrow? Lens क्योंकि is one topic जो आता ही आता है, and you cannot escape it. We can keep cataract and the lens tomorrow. PDR and NPDR. Okay, so PDR or NPDR, as the name suggests, one is non-proliferative diabetic retinopathy and one is proliferative type. Non-proliferative is the earliest one, and from NPDR we can go to PDR. Non-proliferative means it is no बहुत ज्यादा distraction है. ठीक है। तो नॉन प्रोलिफरेटिव में क्या है, वी हैव माइक्रो एनोरिज्म्स, वी हैव डॉट्स, वी हैव ब्लॉट्स, वी हैव गॉट हार्ड एक्सुडेट्स. Thank you. Even I have won this award of beauty with brains, and but I do not want to distract you towards that side. So, but because you people are telling me that so many times, so it is just for your kind information. I have won that award, Beauty with Brains. Thank you so much for acknowledgement. तो उसमें क्या है कि in the NPDR we are not having any proliferation, no new vascularization. But when we have got lot of this ischemia and hypoxia, then we will start having neovascularization, which is the hallmark of PDR. So that is a basic difference. If there is no neovascularization, it is NPDR. When we have neovascularization, that will be PDR. That is a basic difference. Now, can you tell me what is the investigation of choice? Can I ask you one question? What is the investigation of choice of diabetic retinopathy? Eye with the vision of ophthalmology. What is this injection? Avestin. Avestin is actually the anti-VEGF agent. This we are giving in cases of neovascularization. Like in cases of PDR, we can give. Very good. FFA. Because diabetic retinopathy is a microangiopathy. Because it's a angiopathy, that is why the investigation of choice is actually the angiography, right? Then hyphema is actually the blood in anterior chamber. Whenever we have trauma, we can have blood in anterior chamber. Then can you tell me which vein is used to inject the dye? Which vein is used to inject the dye in cases of FFA? Which vein is used to inject the dye? नोबिता बहुत होशियार लग रही है, लग रही है. इज शी अ गर्ल? नोबिता तो बॉय होता है ना. Anticubital vein, yes, it is the anticubital vein that we are using for the injection of the dye. Very good, it's a anticubital vein that we are using for the injection of the dye. Yes, बॉय ना, वही मुझे लगा. नोबिता और डोरेमोन दोनों ही बॉय हैं, तो इट इज नॉट अ गर्ल. ठीक है ना. तो आर वी रेडी फॉर लेंस टुमारो? क्या क्या पढ़ेंगे हम लेंस में? कैन यू टेल मी क्या क्या पढ़ने वाले हैं? एनाटॉमी फिजियोलॉजी ऑफ द लेंस, देन व्हाट आर द टाइप्स ऑफ कैटरेक्ट, देन उसके बाद द डिफरेंट काइंड्स ऑफ सर्जरीज, वेयर डू वी गिव द इंसिजंस, व्हाट आर द साइजेस ऑफ इंसिजंस, what are the complications, and then what are the treatment options, all these things. Lens is very very important. Congenital senile cataract, types of surgeries, complications, even the lens anomalies also, systemic associations of the lens also, trauma, सब important. Yes, yes, सारा कुछ important लेंगे. NPDR control, NPDR control injection मतलब टाइप्स ऑफ IOLs भी ले सकते हैं. डिफरेंट टाइप्स ऑफ सर्जरीज होंगी तो उसमें डिफरेंट टाइप्स ऑफ IOL होंगे. यस, वो भी हम लेंगे. और क्या है उसके अलावा? जितने भी PYQs आए हैं लेंस में रिलेटेड, हम वो भी डिस्कस कर लेंगे. Those questions which are expected to come and which have already come up in the lens, that also. सनफ्लावर कैटरेक्ट तो आज ही बताऊं, कल का वेट करते हैं, कल पढ़ के आना तो ज्यादा अच्छा लगेगा. There are three causes, तो hint देती हूँ. There are three causes of sunflower cataract, and this is a homework for you. Tomorrow you have to tell me these three causes of the sunflower cataract. What are the three causes of sunflower cataract? किसी को अभी पता है तो अभी भी दे सकते हैं. Otherwise you can come reading tomorrow and you can tell. What else? Any FMG student also here? Hi, yeah, it will be more than enough if you have done the notes, and if you have done with the notes and with the PYQs, nothing extra you require. Just do the constant practice of the MCQs, and सर कल क्या? तो तुम कल तो लेंस पढ़ के आएंगे आई थिंक. And if you, yeah, so I was saying that if you have read my notes along with the PYQs, along with the constant practice of the MCQs, nothing more is required. Even, those people who are giving MLE, those people who are doing opthal residency, they are also reading these notes. So they are more than sufficient. ठीक है ना. कल क्या पढ़ के आए हैं, उसका जवाब मैंने दे ही दिया है. 10 PM पर क्विज सेशन होगा. यस, तो एक्चुअली वी आर working on it, and very soon we will be bringing the quiz again, because I want that a fresh batch of quizzes to be occurring, and we will be doing that. हाँ, एग्जैक्टली, मैं भी वही कह रही हूँ कि प्लीज कॉन्सेंट्रेट ऑन द लेक्चर, डोंट बी डिस्ट्रैक्टेड एंड डोंट डिस्ट्रैक्ट अदर्स ऑल्सो. Difference between the this is the micro incision cataract surgery and the phaconet. So micro incision में the incision size. तुम लोग ना मुझे भी डिस्ट्रैक्ट कर देते हो. मैं क्या बता रही थी, कि माइक्रो इंसिजन कैटरेक्ट सर्जरी में जो इंसिजन साइज होता है दैट इज लेस देन 2 mm. ठीक है, फेको में इट इज 3 to 3.5 mm, एंड जो फेको निट होता है उसमें इंसिजन साइज इज ओनली 1 mm. सो दैट इज द बेसिक डिफरेंस. वी आर डूइंग द सर्जरी विद लेसर एंड लेसर साइज ऑफ द इंसिजन, वो हो जाएगा. ठीक है, तो आई थिंक दिस इज ऑल फॉर टुडे. आज के मैंने शायद सारे के सारे डाउट्स बता दिए हैं. प्रिपेयर टुमारो well for your class. Today we have done the random ones, and tomorrow we will be doing the specified ones. Tomorrow we will be doing all the doubts on the lens. ठीक है ना. Any video you have about the biometry? बायोमेट्री के लिए तो मैंने शायद नहीं किया है, बट soon I'm planning to do more videos for biometric students as well as this residency also. So देखते हैं. Let's hope for the best, and tomorrow we will be meeting with the lens. तो आप पढ़ के आना so that we can have good discussion over it. Okay, so goodbye guys, take care, happy ophthalmology.